So we have with us a patient who has flown in from Delhi to get operated for a post-hysterectomy ovarian cyst. This was a post-hysterectomy bilateral ovarian endometriosis. And now she's 24 hours after her surgery. Her Foley's catheter has been removed and we have stented both her ureters. What is important to tell the patient in this situation is that the patient is going to be allowed to go home after she passes urine in the hospital. We want her to pass urine in the hospital at least 2 times. All right. Why is this important? Because when you are operating a post-hysterectomy ovarian cyst, your dissection is very deep down. This deep dissection can cause some amount of neuropraxia. And the neuropraxia would normally recover because it is self-healing. It recovers very, very, very beautifully. But still, you have to be careful and the patient has to pass urine in the hospital premises. That is point number one. Point number two, the patient has to stand up, walk, ambulate. Ambulation of the patient is critically important in these surgeries. And third, because both the ovaries have been removed, the patient will be counseled for giving her HRT, that is hormone replacement therapy, which is typically started 4 to 6 months after surgery. This waiting period is important because her body will have fat reservoirs of hormone of estrogen, which will suffice for her body. And these instructions we should give her before we send her home or before we allow her to fly back to Delhi.